Well, a very good afternoon to you all, ladies and gentlemen. It's extremely good to be back in my role as the head of the Health Policy Group. I'm really delighted, thrilled to introduce this to you. It's a revised health policy. It is a really comprehensive plan. It's called an NHS Fit for the 21st Century. And I want to say a very big thank you, actually, to Dr. René Hundekamp and also to Dr. Asim Malhotra, two very clever doctors. Three of us have sat down. We've gone through all of the notes from the Health Policy Group, and this is what we have come up with. And I hope you will be enthused, excited by what I'm going to tell you. So I think it's important that we start off by reminding ourselves of some of the key facts and the key issues that underpin the really big problems in the NHS. Let me be very clear, these are huge problems and they have got a lot worse over the last 12 months. So let's start with 8 key facts. So, first of all, health is the great leveller. If you do not have good health, you have nothing. So it is the most crucial thing that we can offer. The NHS is an integral part of the United Kingdom. Now, whether you love it or whether you hate it, it is a national institution. It is probably the most loved healthcare system in the world, but it provides very mixed care. When it's good, it's great. When it's bad, it's shocking. It is patchy, it's geographically dependent, and is a postcode lottery. And quite frankly, it is simply not good enough. And satisfaction amongst the British public with the NHS is now at an all-time low. Now, people say all the time, this is because you don't fund it enough. Well, that is utter rubbish. Funding for health services comes from the Department for Health and Social Care. Let me tell you, in 2021-22, we spent £192 billion in England alone on the health service. Now, that money goes to lots of different things, but it is also worth remembering, on top of that £192 billion, we also spent another £33.8 billion responding to the COVID-19 pandemic. That includes PPE, the vaccines, and of course improving discharge for patients in hospital. And why do we need so much money? Well, the simple truth is actually the staffing budget for the NHS is vast. The NHS is one of the world's largest employers. There are 1.2 million people who work in the NHS. The wage bill alone is £56 billion a year. That is 47% of the NHS budget. And crucially, and here's something you may not know, that does not include GPs. And the reason for that is because GPs are not salaried by the NHS. GPs are private, independent contractors. And many people do not understand the difference between that, or at least are appreciative of that fact. So I told you we spend a lot of money on staff. How shocked would you be if I told you that 48% of the staffing budget goes on people who don't see patients? That is utterly ridiculous. There is huge waste in the NHS. There is vast levels of bureaucracy, and it really needs to go. Let me just explain how much everything costs, and this is something I used to do when I was an A&E doctor. So if you go to A&E, it costs about £400 to be seen, roughly. So it's important that only the people who need to be in A&E go to A&E. Otherwise, we are wasting money hand over fist. Let me compare that with going to see a GP. So £400 for A&E, a GP costs about £40, and that is where the vast majority need to be seen. But here's the irony of the whole thing. If you are already registered with the GP practice and you end up in A&E, we're paying twice. So it's crucial that we get the right patient to the right service. If you call an ambulance, the cost of that is about £500 before you get to the hospital. So £500 plus £400, so we're at £1,000 to be seen in A&E before you have any treatment at all. And I told you that in terms of the staffing, we have the most extraordinary number of people there, 1.2 million. How many doctors do you actually think we have? Well, the answer is 123,000. Only 10% of the staff are actually doctors. 332,000 nurses, and it is incredibly difficult to find out how many managers there are. But let me tell you, we think there are more managers than doctors in the NHS. That is simply unacceptable. Now, over the last few months, and I know time is tight, but I'm really passionate about this and I want to get through all the points. Over the last few months, I've had a health policy group. It's been led by amazing people, doctors, nurses, pharmacists, financiers, patients. And a very big thank you to Jackie Garside, Ray Radford, Nick Yeomans, Marcus Innocent, Jane Lindley, Carol Olding, Barbara Broadbent, Rob Watson and Natasha Hauer. And from everything we pulled together, that is what went off to a scene to Renee and to me, and that's how we've ended up where we are. So it is really important that we move on and identify those problems. So we identified a myriad of problems. So first of all, we said staffing. There are more than 40,000 nurses, you will have read this week, have left the NHS in the last year. So even though we are recruiting 43,000 nurses, actually we haven't recruited any because we are losing so many people as a result. We are seriously lacking in clinical staff. By 2030, we will have 8,800 fewer full-time GPs. And in 10 years' time, 25% of the entire British population will not have a GP. That is how stark this is. And why is this? What is going wrong? Well, what's happening is staff do not feel valued. They're demoralised and they're demotivated. So young doctors, as I was once, you come in, you're fresh, you're excited, you want to get going. They're leaving in the first year because they hate it so much. So that has to change. GPs, as I said, are leaving the service. We have lost 700 over the last 3 years. Many GPs now working part-time because it's simply hideous. And the average GP works 3.5 days a week. More worryingly, one-third of GPs will leave in the next 5 years. We are already short of 12,000 hospital doctors. We're short of 50,000 nurses and midwives, and by 2030, in 8 years, we will need 1 million jobs. It is a huge problem. Second problem, waiting lists. I said this morning, 6.8 million people waiting for elective procedures. That is utter nonsense. We believe it's something like 12 to 15 million patients. Those figures are being massaged by central government. We know that over 4 million people waited more than 2 weeks to see a GP. Hospital beds. When I trained, there were 300,000 beds. There are now 140,000. We've cut the beds in half, but at the same time, the population has grown by 20%. How does that make any sense? Well, of course, it doesn't. Then the patient, the poor patient lacks any control at all in the system. You go to see the doctor says this is what you should do, and the patient says, okay. You can't see someone else, you can't have a second opinion. It is a big problem. And also, it is the national ill health system. It is not the national health system. We need to be talking about preventative, proactive healthcare, and that is how we reduce the cost to the NHS. I just want to say something about bureaucracy in the NHS. There are insane clinical targets. They are totally meaningless. We need to stop talking about targets. We need to start talking about outcomes. And when you have targets, it encourages managers to fiddle the figures. And let me give you a really good example of this. In A&E, they introduced wait times, right? So you couldn't wait in A&E for over a particular period of time. So what did they do? They actually set up assessment wards, which they moved the patients to, but that's okay because they're no longer waiting. Well, it's not okay. And so they fiddled the figures. And the problem with this is that actually it costs more, staff were diverted, and it was a total waste of time and very poor outcomes for the patient. The systems don't talk to each other. We know many of the primary and secondary care IT systems don't talk to each other. There is such a lack of accountability in the NHS. No one takes responsibility for when things go wrong. Many hospital trusts will avoid investigating and sharing errors. And what comes first, every single time, is reputation management of that hospital. It shouldn't be like that. It should be about world-class care for the patient. You all know this, there is a massive lack of social care. We have a major problem. We can't discharge people because there's nowhere to go. And we are lacking, in terms of the beds that are available, 13,000 beds in hospital are occupied by people who shouldn't be there. So if I could discharge those 13,000 people, that liberates 10% of my hospital beds. But I can't because there are several factors at play. And then it probably won't surprise you to learn that procurement is a complete mess. Different trusts buying different things at different prices and probably some money or other benefits changing hands, and that is all got to stop. We have to offer centralised procurement so that we can save money. And crucially, one other thing that we identified. There is no long-term workforce planning. And the government's admitted it, Labour's admitted it, and no one's done anything about it. And the government and the opposition, well, they simply don't have the answers. The King's Fund said of the government's plans, this is tinkering around the edges. The Health Foundation says the plans are a few short-term fixes, and the Royal College of General Practitioners says this plan will have minimal impact. So what do we need to do? Well, we need to be bold, we need to be radical, and we need to completely reform the system. We can no longer tinker at the edges. So we are going to build an NHS which is fit for the 21st century. The principle, the fundamental principle remains that the NHS remains free at the point of need. It's really important that. So money doesn't change hands, but we can improve the systems. And I've got a 5-point plan to address this and to build this super NHS. Now, firstly, we need to increase capacity. This is a major problem. We need to take the burden off A&E. Too many people in the wrong place. So we want to roll out a nationwide strategy that helps people to understand which services they should go to first. And we are proposing we roll out a national campaign with a slogan, pharmacy first, GP second, A&E last. And the reason for that is there is capacity in pharmacy services. Many pharmacists can prescribe. They're incredibly good. They're incredibly well trained. And many common ailments can be dealt with by a pharmacist. Then second line GP, third line to A&E. We can talk about that later, but certainly walk-in centres would play a role in that as well. But let me go back to something that Richard said as well. Why are we expected to wait so long to have clinical care? So if you are ill and you cannot work, you are not contributing to the economy. We need to be aiming for something much bigger. We need 0 waiting lists. I want to reiterate what I said last year. If you cannot see a GP in 3 days, you will be given a voucher to go privately. If you cannot see a specialist in 3 weeks, you get a voucher and you can go privately. And if you cannot get an operation in 9 weeks, you get a voucher to go privately. What that will do brilliantly is it mushrooms the private sector, we get competitive pricing, it helps the NHS, and waiting lists go down. Now, in fact, Labour used a similar concept in the early 2000s and had very good results. We want to encourage people to use private healthcare as well. There is nothing dirty about private healthcare. So we want to give tax breaks for individuals and companies to increase enrolment in private schemes. That will dramatically reduce the burden on the NHS. We also need to stop doctors doing unnecessary operations. 15% of operations are totally unnecessary and do not need to be done. Aseem Malhotra told me 30% of cardiac stents are for stable disease. We do not need to do those. We need to stop bed blocking. We need to improve social care. And we need a nationwide campaign about how to improve health, a preventative health strategy with marketing, advertising, education, encouraging bog-offs, buy one, get one free, on broccoli, on salmon, not on chocolate. We need to offer the public incentives to be healthy. Let's look at staffing. We do not have enough medical students. There is a ridiculous cap on the number of medical students that we train to become doctors. We propose getting rid of that cap completely, and here's another really good idea. It is very expensive to become a doctor, and we are recruiting the wrong people. I want to see kids from the inner city who know what it's like to struggle, who understand health inequalities. I want them in medical school. And if you stay in the NHS for 10 years, we will pay back all of your fees. We need more nurses. Whose bright idea was it to say that all nurses need to go to university? Well, they simply don't. We need to bring back the state-enrolled nurse. So I also told you we don't have enough GPs. There are 10,000 retired doctors like me. I still hold a license to practice. I can prescribe, but I'm not being used. I volunteered in COVID. Did anyone ring? No. So here's an idea. We will take those 10,000 doctors like me and offer them a one-year fast-track training course into general practice. That way we deliver 10,000 new GPs in 12 months. It may sound soft, but what we have to do is improve working conditions in the hospitals. I want doctors and nurses to be given hot meals at 24 hours of the day. I want them to have water fountains. I want them to have rest areas. None of that is available at the moment, and that is why we are losing staff. It is simple to do, it is effective, and it will improve outcomes for patients. Something else that is utterly ridiculous is the pension changes that have happened for consultants. 10% of GPs and consultants are planning to leave the NHS in the next 18 months. And the reason for that is because of pension rules. And that will see them paying to work. The way this works is doctors have a lifetime cap on their pension. So if they exceed it, they pay tax. So they retire. 70% of surgeons have reduced their hours to ensure that they fall under that cap. So we will abolish that. We'll abolish the cap, allow the surgeons who want to operate and get patients into operating theatres. And in the short term, yes, of course, we're going to have people from overseas to plug those skills gap. We need more doctors, we need more nurses. But what I'd like to see is fast-tracking visas from countries that share our values, from Canada, from the United States, from places like India. Because actually, these are brilliantly trained medical graduates. They can come here, they speak English as a primary language. Let's get them here working for the NHS whilst we build up British capacity. My third point is that I want a radical overhaul of management. We have to slash sways and sways of management positions. As I said, remove targets. focus on outcomes. We need to reform medical education. We need to start talking about systems. We need to start talking about preventative medicine. We need to stop talking about just being sick and ill. Those IT systems need to change as well. And we believe that 40% of GP appointments do not need to see a GP. So with some radical change and some education, we can reduce the burden on the GP. And there is one final point here. Do you remember PFI? That was a very clever idea, wasn't it, Mr. Blair? So, let me tell you, it costs billions and billions of pounds every single year to service the debt from PFI. I've spoken to a number of trusts. For every £6 they're given, £1 goes to servicing the PFI debt. That is utterly ridiculous. We are proposing a one-off write-off of all the PFI hospitals so they go into the NHS. In terms of waste, let me just tell you about the pharmaceutical bill. How many of you go to see a doctor and you're given more and more drugs? No one asks you what other drugs you're on. The patients often don't know what drugs they're on. Well, I can tell you the pharmacy bill alone is £17 billion to us every single year. So we think we can cut down on the number of prescriptions being given to patients. And in line with that, 25% of over 65-year-olds have drug interaction side effects because no one knows what they're on. They give them more drugs, and what happens? They end up in A&E with terrible drug side effects. So again, better prescribing, less prescribing, and more focus on the individual patient. And in terms of procurement, it is ridiculous that if you want to buy, say, something like a liver trocar, one trust will be buying it at £5, another will be buying it at £50. So we believe that we should have centralised sharing of best pricing and best deals and best practice to lower the cost to the NHS of buying in medical supplies. It is not rocket science. And my final point, and I've thought a lot about this, I want to provide world-class primary care. And let me tell you what I mean by that. GPs currently are paid on what is called a capitation basis. So it means they're paid for every single person that is signed up to their list, whether they see you or not. That is simply ridiculous. We will tear that up. And what we'll do instead is we will pay GPs on results, the number of patients seen, and how fit and well their patients are. And that is a radical reform proposal. And one final point in terms of primary care. As I said right at the beginning, most GPs are actually private businesses. The average GP is doing pretty well. The average GP earns around £140,000 before they're paid on top of that for other targets that are imposed upon them. It's unsustainable. What we would like to propose is that for all newly qualified GPs, instead of being in a private practice, they will be offered the opportunity to be directly employed by the NHS at a fixed salary rate with conditions of employment, fixed hours, and they will have to offer out-of-hours services. They will also have, in their time, the amount of time included to include paperwork and admin. And crucially, we will stipulate there have to be minimum service levels of face-to-face patient contact. It's bold, it's radical, but we believe it can be done. In summary, our plan delivers better doctors, better nurses, better decisions, and crucially, better patients. Thank you very much.